quick notes on sickle cell anemia. Sickle cell anemia occurs due to abnormal structure in the structure of the hemoglobin of the HP chains, and it is caused by the mutation in the beta chain, and which results in shortened RBC cell survival and impaired passage of red cells through the microcirculation. So microcirculation, these RBCs become sickled and will have impaired passage through the microcirculation, and that causes the main symptoms and leading to obstruction of small vessels and tissue infarction. The cause is inherited, and the sudden deterioration occurs in sickle cell anemia due to splenic sequestration, and there will be acute painful enlargement of spleen due to pooling of red blood cells, and there will be bone marrow suppression, and this is mainly due to the parvovirus infection, and there will be further hemolysis, and it is due to either infection or drugs. Next we will see the clinical features, and there will be delayed growth and development, and there will be delayed puberty, and bone pain will be there due to vaso-occlusive episodes, and this bone pain will be symmetrical on both sides, and osteomyelitis, mostly due to Salmonella staphylococcus infection. Then avascular necrosis of hip, compression of vertebra, and abdominal pain, and this can mimic the appendicitis or cholecystitis. Then pulmonary hypertension, spontaneous leg ulcers. It's also due to vaso-occlusive episodes. Cardiac problems like cardiomyopathy, and it is due to iron overload, myocardial infarction, arrhythmia, then in pregnant ladies, spontaneous abortion, IUGR, preeclampsia, fetal death, and this is due to the impaired placental flow, and there will be severe infection, particularly meningitis, septicemia, and bone infections. Next, a brief note on the management and the aim of the treatment. Aim of the treatment is first, avoid precipitating factors. We have to look into the precipitating factors. And avoid them. Then aggressive treatment of the acute complications. Acute painful attack management, acute pain management. Then management of anemia, penicillin prophylaxis to prevent significant infections, pneumococcal vaccination, so let's get into the treatment. Treatment of sickle cell anemia, actually no cure. There is no Permanent cure for sickle cell anemia. Minor crisis can be safely managed at home with NSAIDs. So, minor crisis we can use painkillers, NSAIDs, and increase fluid intake that can be managed at home itself. And this fluid intake or IV fluids are for the vaso-occlusive crisis. And for chronic pain syndrome, we can use NSAID or morphine. And for chronic hemolytic anemia, there will be folic acid often deficient, so folic acid supplementation. And the only drug that may have some direct benefit is hydroxyurea. And this increases the formation of fetal hemoglobin and reduces the hemolysis. And then prevention and treatment of infections, penicillin prophylaxis. And because children can get recurrent pneumococcal infections which can precipitate the crisis, and can be started at age 6 months, and this penicillin prophylaxis can go till 5 years of age. And management of complications and the various organ damage syndromes associated with the disease, that depends on the organ that gets affected, like which organ is getting affected, like kidney, bone, strokes, etc., and specific managed for them. And detection and treatment of pulmonary hypertension and that is important because this can lead to death. And then prevention, some preventive measures should be taken as general practitioners for preventing the complications. And so insist on regular visit, and at least every 3 to 4 months. And others may need much more frequent observation. Educate patients on how to prevent sickling crisis, and precipitating factors should be educated to them, like what are the precipitating factors. Precipitating factors can be infection, dehydration, and cold, hypoxia, like heavy exercise, high altitude, drugs like acetazolamide, hypertonic radiographic dyes, alcohol, then pregnancy, diabetes mellitus. Educate all patients to recognize signs of infection, increasing anemia, and organ failure. Treat all infections, even trivial ones, and we should aggressively treat all the infections. Institute pain medication at the earliest symptoms of vaso-occlusive crisis. Patients on a chronic transfusion program can adhere to the iron chelation therapy. And hydroxyurea should be continued for patients who are selected to receive that drug. A long-standing NSAID is given to the patient with a chronic pain. Advice regarding problems of consanguinity.